All right, we're shifting focus now to our top story this hour. It's the AIIMS Delhi that has now come up with a new standard operating procedure in order to streamline medical care services for sitting MPs. Now, this has prompted doctors at the Premier Institute to question and condemn the move. Now, as per the order, the hospital administration should be available in the control room round the clock for OPD and emergency consultation, as well as inpatient hospitalization of Lok Sabha as well as Rajya Sabha MPs. Now, it also says that all other patients who are referred to AIIMS for consultation or treatment by the MPs should also be provided due assistance by its media and the protocol division. Now, the duty officer will be the nodal officer in order to coordinate and facilitate the requisite medical care arrangements for all of these sitting MPs. Now, this move, of course, has drawn severe criticism from the doctors who are condemning it, calling it promotion of VVIP culture. Now, this is what they say. Why should patients suffer for others' privileges? They've also gone on to say that the Prime Minister says that we should not be promoting VVIP culture in India, but it's AIIMS, the director of AIIMS, in fact, that's promoting VVIP culture. This is as far as the entire situation is concerned, with respect to that's coming in from the entire controversy. In fact, we have some voices from on ground on what they think about this issue. Let's listen in.
वहाँ जाते हैं तो बोलता है नंबर लगाइए हम लोग भटक के जाते हैं तो इसको पूछते हैं तो बताता है वहाँ पे जाके लाओ ये रिसीव करा के, तो वहाँ जाते हैं तो बोलता है कि जाके इमरजेंसी में दिखाओ, इमरजेंसी में जाते हैं तो बोलता है ओपीडी में नंबर लगते हैं तो डर नहीं लगता।
और 3 दिन से आकर परेशान है, कोई डॉक्टर भी नहीं देख रहे हैं, डॉक्टर नहीं देख रहे हैं। इधर मैं भटक रहा हूँ, बोले उधर जाओ जब लाइन में लगी रहती हूँ, खड़ी होती हूँ, जब नंबर आता है तो बोले कि कार्ड खत्म हो गया।
अगले साल की डेट दे रखी इन्होंने।
अच्छा, अगले साल की डेट दे रखी है। और बीच में इलाज हो पा रहा है?
बीच में इलाज में हो रही हो पाँव भी दिक्कत आ रही, चलाई नहीं जाता।
तो अभी आप जा पा रहे हैं, डॉक्टर को मिल पा रहे हैं?
तो उन्होंने कह रहे तुम तो एक दिन पहले आ गए, मंगल में शुक्र अब कल से यहाँ रहना पड़ेगा, कल भी देखना।
Ila joins us live on the broadcast for more on this. Ila, we just heard those voices who are outside, the AIIMS hospital, some patients, their relatives. For all our viewers who have just joined us, if you can tell us, why has this issue become such a big controversy? What are the both sides saying?
Well, newly appointed director of All India Institute of Medical Science, M. Srinivas, has written to the Secretariat of Lok Sabha Secretariat Joint Secretary, and in that he has suggested SOPs. Around 11 SOPs have been given in this letter, and in this letter it is given that for the MPs of both Lok Sabha and Rajya Sabha, certain kind of provision should be made for their treatment. A nodal officer would be available for their treatment round the corner, around the clock, and he would be treating him, he would be looking after his treatment. And not only that, but also a phone number is given, and as well as landline number is given. A control room would be made for them to run around the clock. A control room would be running for the treatment of those MPs of Rajya Sabha and Lok Sabha. And not only this, basically they wanted to streamline the treatment of the both MPs of Rajya Sabha and Lok Sabha, and that's why such SOPs have been issued. And in these SOPs, it is also clearly mentioned that the staff or anyone who is referred by a member of parliament, then the person would also get the same kind of protocols and benefits, and also the protocols would be followed for his treatment as well. So this is getting criticized, and most of the resident doctors are protesting against this, as they are saying that this is a VIP culture, and everyone should be treated by the same manner. And we have seen how the patients struggle outside. The AIIMS dates and re-dates are given to them, and they have to stand in long queue to just get a single appointment.
Right.
Here I tell you a case of a child who is just 6-year-old having a heart issue. He has to wait for 2024 to get himself operated, and that's why this is being criticized by the doctors. Back to you.
Absolutely. You know, why should the rules be any different from the Aam Aadmi Party or the MP? They should all be treated equally. That's exactly what we're going to be discussing tonight on the broadcast. I am being joined by Dr. Ishwar Gilada, Secretary General of the Organized Medicine Academic Guild. I will also be joined by Dr. Rahul Chakravarti, Vice President of FEMA. Dr. Gilada, before I come to you, there are certain statistics that I want to quote for our viewers, for them to, to give a sense of why we are talking about this. Now, you know, for every 1,000 patients in the national capital, we have about 2.7 beds. Let's just say we have 3 beds. The second figure over here is that for every 1,000 patient, there are just 3 doctors. You know, that is the kind of situation that we're talking about. I've given you the statistics. It's quite clear that the situation is not very encouraging. Dr. Gilada, in such a scenario, how difficult does it become for somebody, for an Aam Aadmi, to access basic health services at a time when MPs are given such kind of preferential treatment, such priority?
Apeksha, there are 2 things in this. You know, basically, sometimes we also feel that member of parliaments or ministers or VVIPs should go to public hospitals so that they understand what is the meaning of public hospital. And maybe the status of public hospital will improve. But that doesn't mean that they should get out of blue treatment. Now, what you are explaining here is for 1,000 odd people, like there are 570 member of parliaments and another 230 or 270 Rajya Sabha. So total for 1,000 people, you have a control room or a doctor. And for remaining 2 crore people, you have another control room or a doctor. So I think that is not explainable properly. Secondly, even in the interest of VIPs themselves, ministers, MPs, or MLAs, or whoever, they should go to public hospital and stand in a queue. That will attract a lot of attention to them that, look, this is a public representative. I remember once I was traveling to Bangkok and Maharashtra Chief Minister was there. And when I went to request the gate that he's our Chief Minister, please allow him to go early in the hall, he said, no, please don't do that. Here I am a delegate. I will behave as a delegate. I am not a VIP. So I think that kind of probity should be there in public life. So what you are explaining, that member of parliament and whoever they refer to, they should be treated with that kind of priority. I don't think that is the right thing. Secondly, people thronging on the tertiary care centers, also that is also wrong. Primary health care, they should go for primary responsibility problem, then they go to secondary, and only when they are not managed at secondary level, they should go to tertiary. But everybody has something in mind that AIIMS means a top institute in the country, as if there are no other institutes in the country. Thirdly, those doctors in AIIMS also, they are also trying and vying for some kind of some place in some committees or some awards, and they always try to do this thing. I don't know why this director, new director, had to write on his own that these are the SOPs or standard operating procedure. So by having a standard operating procedure member of parliament, you cannot treat other people as substandard. So that is what I would like to say.
Dr. Gilada, there's one more thing that, I want to know from you in terms of logistics and money involved. How much of a pressure can we expect on health services? And let's, factor in one point that this is AIIMS in Delhi that has recommended this. It's quite possible that, they can take other hospitals, other government big hospitals across the country can take cue and think about implementing a certain, SOP. So what kind of impact can we expect on health services?
See, I will give 2 classical examples of Tata Cancer Hospitals in Mumbai. What they have done, they created a system where there is a free system and paid system. And those who are paid, they are seen by the same doctor, but the doctors are rotated. So out of a week, one doctor will sit for 2 days in paid and 3 days in free OPD. And whether MP or a member of parliament or anybody or who want to pay, they go in that paid line. Secondly, what they have done also is that whatever income is generated from those paid people, that is distributed 60-40 to hospital and doctors. And doctors also get that kind of incentive. So they would stay in the country. They would stay in the government system. So Tata Hospitals is considered currently a kind of a role model. Secondly, good role model of Tata Hospital is also they started a second opinion system. For second opinion, you don't have to go to hospital. You take an online appointment. You pay some 1,500 fee for second opinion. You upload your all reports and you will get an opinion by within a week or two, or maybe 1 or 2 days if it is case is urgent. And that is seen by the same doctors who are managing the patient in Tata. So by getting second opinion, you can decide whether the diagnosis of particular person is perfect or not and where the treatment can be given. In the second opinion, they will also say that you can be treated in your hometown or in this place or that place. So your pressure on that hospital can reduce. So similar system could be adopted in AIIMS and other public hospitals as well.
Dr. Gilada, some very interesting points that you're making as far as this entire issue is concerned, and that's the thing that we're talking about, that this culture about more equal than the equals is something that it does not come across as a very healthy one that we should be promoting. Dr. Gilada, thank you so much for joining us with your inputs and sharing your time.